At the end of this video, you will be able to differentiate between glaucoma and ocular hypertension and the relationship between them. And you will know something about the intraocular pressure and the aqueous humor. What is the definition of glaucoma? Glaucoma is a group of diseases in which there is a pathological intraocular pressure which causes optic neuropathy and visual field defect. Pathological intraocular pressure which may be elevated intraocular pressure sufficiently to cause damage to the optic nerve, or just normal intraocular pressure, but it also causes damage to the optic nerve. So normal intraocular pressure and optic neuropathy and visual field defect, but with normal intraocular pressure, is called normotensive or normal tension glaucoma. If there is only raised intraocular pressure, but without optic nerve changes or visual field defect, it's just called ocular hypotension. But if there is visual field defect only with normal intraocular pressure and there is no structural optic nerve changes, search about the cause. There's many causes which can cause visual field defect. So from the definition, you know that the ocular hypertension not essentially means or not necessarily means that there is glaucoma. We said there is glaucoma if there is visual field defect and optic nerve changes with or without increased intraocular pressure. What is the intraocular pressure? Intraocular pressure is the pressure inside the eye. It's caused by the content of the eyeball. The content of the eyeball is the aqueous humor, vitreous humor, lens, everything. But we focus on aqueous humor because aqueous humor is changeable. Normal intraocular pressure is from 10 to 22 millimeter mercury, and the normal difference between both eyes is less than 4 millimeter mercury. Also, there is normal diurnal variation between 2 to 3 millimeter mercury on the morning and on the evening. What is the cause of this diurnal variation? This is diurnal variation mainly caused by cortisol or steroid. What is the effect of steroid? Steroid causes water and salt retention. So it increases the blood volume. So it increases the diffusion of the aqueous humor from the ciliary process or ciliary body blood vessels into the anterior segment of the eye. The second cause is the venous congestion. Venous congestion during sleep. When you are sleeping, the blood stagnates in the venous circulation due to the loss of the effect of the gravity and the venous system in the eye. Also, there is stagnation there. So there is a decrease in the drainage of the aqueous humor from the eye to the venous circulation. After that, aqueous humor. What is the aqueous humor? Aqueous humor is transparent intraocular fluid that fills the anterior and posterior chamber of the eye. Its volume is about from 2 to 3 microliter per minute. Aqueous humor function. The aqueous humor is very important to maintain the normal shape of the eyeball, to prevent its collapse, and also it acts as a refractive medium because it's transparent. Also, aqueous humor is very important for the nutrition of the avascular structures of the eye, like lens and cornea. Formation. How the aqueous humor is formed? Aqueous humor is formed by the ciliary processes of the ciliary body. We'll show now a picture of this is the ciliary body, and its projection is called the iris. This is the ciliary processes. Finger-like projection secretes the aqueous humor. This aqueous humor is derived from the ciliary stromal blood vessels into the ciliary processes through the non-pigmented epithelium to pump it into the posterior chamber of the eye. There is two mechanisms for secretion or production of the aqueous humor: passive and active mechanisms. Passive mechanism is dependent on the hydrostatic pressure and osmotic pressure, the pressure gradient differences between the stromal blood vessels and the interstitium of the ciliary body or ciliary processes. Ultrafiltration, which is the pressure gradient, is because the intravesicular or the pressure in the blood vessels of the ciliary body, the hydrostatic pressure is more than an interstitial hydrostatic pressure, and the osmotic pressure inside the interstitium is more than the osmotic pressure in the blood vessel. So the net power is to drive the fluid from inside the blood vessel to the interstitium. But this is not the main mechanism. The main mechanism is the active process, which depends on sodium, potassium, ATPase pump, and carbonic anhydrase enzyme. By pumping sodium chloride from the blood vessels into the posterior chamber, and the water will follow the sodium chloride. This is the process by which aqueous humor is formed. So, the circulation of the aqueous humor. As we said, aqueous humor is formed through the ciliary processes and formed and pumped into the posterior chamber of the eye. The posterior chamber lies between the lens posteriorly and the iris anteriorly. The fluid is then passed through the posterior chamber and through the pupil to move to the anterior chamber of the eye. Then it passes through the this is the iridocorneal angle to be absorbed or drained. The drainage of the aqueous humor is dependent on two mechanisms. The first mechanism, which is the most important, is through the opening in the iridocorneal angle. Iridocorneal angle, or the angle of the anterior chamber, is formed by the cornea. This is the cornea. Its lower or lowest layer, which is called dissonance membrane, and the ciliary body, the base of the ciliary body, and the origin of the iris, also the part of sclera. This angle is formed by the trabecular meshwork, which is fenestrated perforated network, able the aqueous humor to pass through to reach the canal of Schlemm, which is the canal of Schlemm. From the canal of Schlemm, it passes to scleral veins, then aqueous vein, then to the episcleral veins and ophthalmic veins. This is the main mechanism. Another mechanism is by absorption through the iris or through the ciliary body directly, which is called uveoscleral pathway, but it's least important. How we can measure the intraocular pressure? We have two methods. The first method is digital method, and the second is tonometry. Digital method is by applied pressure by one finger, and the other finger feel, as we feel the consistency of any lump of any tumor. The second method, which is the most accurate method, is tonometry. Tono means tension, metry means measuring. Has two methods: indentation, schiotz tonometer, and Applanation Goldman tonometer. Indentation schiotz tonometer is depends by applying the pressure on the cornea after giving local anesthesia, and see if it's soft, it can be pressed, which means that the intraocular pressure is normal or less. But if it's hard, that means the intraocular pressure is high and prevents prevents it from project posteriorly. The second method is Applanation by Goldman tonometer. The idea of this method is by applying pressure on the cornea until it becomes flat. When it becomes flat, this means that there is equal or equilibrium between the pressure behind the cornea and the pressure in front of the cornea. So the pressure applied to cause the cornea to become flat equal the pressure inside the anterior chamber. After